Hey, we throw around the word health all the time, right? But have you ever stopped to think about what it actually means? Well, today we're going to dig into that, and trust me, it's way more interesting than you might think.
So let me just ask you, straight up, are you healthy? Take a second. How did you answer that? If you're like most people, you probably thought, well, I don't feel sick, so yeah. But is that really the whole picture? Let's dive in.
Okay, so first up, let's tackle the most common way we all think about health. You know, the traditional view, our gut reaction. It's basically this idea that if you're not sick, you're healthy. Simple as that.
I mean, this is literally the classic dictionary definition. You can look it up in Oxford, and it's what's called a negative concept, which sounds kind of bad, but it just means it defines health by what's missing. You know, you're healthy if you're free from illness. It's easy and makes sense, and for a super long time, this was pretty much the standard way everyone looked at it. But, and you probably saw this coming, that is not the whole story, not even close. I mean, it's a useful starting point for sure, but once you start to poke at it a little bit, it kind of falls apart. It's got some pretty big limitations. Okay, just think about it like this. For one thing, lots of diseases have this long, silent phase where they're developing for years before you even feel a thing. So you could be walking around feeling totally fine, but you're not actually in a great state of health. And second, and this is a big one, it just misses so much of what it means to be a person. I mean, being healthy has to be more than just not having a doctor's note, right?
All right, so this is where things get really interesting. The World Health Organization, the WHO, they stepped in and just completely changed the game. They came up with this much, much broader and way more ambitious way of thinking about our well-being. Let's just let that sink in for a second. This was absolutely revolutionary. It totally flips the script from focusing on what's missing, the disease, to what's there, a complete state of physical, mental, and social well-being. This became the new gold standard, and for a really good reason.
The really crucial thing to get here is this idea of the 3 pillars. It's saying health isn't just about your body working right. Nope. It's also about your mental health, how you're thinking and feeling, and it's about your social health, your relationships, your community. It's the whole shebang, the whole person.
Yeah, this chart here really nails the difference. We go from this negative disease-centered idea to a positive person-centered one. Instead of just dodging illness, we're actively aiming for well-being. It's a total 180 in how we think about it.
So this new definition is holistic, it's positive, and that's all fantastic. Huge step forward. But it does bring up a bit of a problem. It's pretty idealistic. I mean, what does complete well-being even mean? That sets an incredibly high bar. And honestly, it's almost impossible to measure perfectly in the real world.
So if the big official definition is this ideal state that maybe no one ever truly reaches, then what? How do we actually make it useful in our day-to-day lives? Or how does a doctor use it? Okay, let's get practical.
And that's the million-dollar question, right? For doctors, for public health experts, and hey, even for us. How do you take this amazing aspirational goal and turn it into something you can actually measure and work with?
Well, to solve that little puzzle, the WHO came up with something they call an operational definition. You can just think of it as the practical, working definition. And it brings us back down to earth a bit. It says there's no obvious evidence of disease and the person is functioning normally. But that just raises another question, doesn't it? What in the world does functioning normally mean?
Okay, so here's the checklist for what it means to be operationally healthy. Number 1, no obvious signs of disease. Check. Number 2, you're functioning normally in your daily life. Check. 3, your organs are doing their jobs properly on their own. And number 4, and this one is super important, all those different parts are working together smoothly, in harmony.
And this next part is maybe the most important takeaway of all. That phrase, functioning normally, it's not one size fits all. Not at all. It's all relative. What's normal for a 20-year-old is completely different from what's normal for an 80-year-old, right? It changes based on your age, your sex, where you live, your community. Health is deeply personal, and it's all about context.
So if there's one thing you remember from this, let it be this. Health isn't like a light switch that's just on or off. You're not just sick or healthy. It's so much more nuanced. It's more like a dynamic equilibrium, a constant balancing act between the physical, mental, and social parts of you, all hopefully working together in harmony.
And that brings us right back to the beginning. So let's try that first question again, but this time using this new, bigger definition. It's not just about whether you have a cold or your back hurts. Thinking about your complete physical, your mental, and your social well-being. How healthy are you really today?